Hi and welcome to this third webinar in the series of doing it in healthcare and distance care, healthcare and welfare in distance learning solutions. Sorry for that. My name is Bengt Andersson and I work at the Nordic Welfare Center. And we will do this in a seminar today with the headline Technology Used for COVID-19 Response, where we'll have practical examples from the digital transform service models in existing organizations.
Yes.
Should I put up the presentation?
So, yes, my name is Niklas Forsling. I work together with Bengt Andersson at this project called Healthcare and Care Through Distance Learning Solutions. This project is part of the Swedish presidency program of Nordic Council of Ministers, and it runs between 2018 to 2021. This is the third webinar that we're having. We have had two previous webinars. We're going to mention them later, but they are available on our website, healthcarethrou-distance.com. We will give you the web address later also. So the main focus at this webinar will be how can we fast-track innovation. So this webinar is also jointly developed and run together with Interreg Northern Periphery program and their COVID-19 response group. If we take the next picture here.
Yep.
Yes, Center for Rural Medicine, that's the organization where I'm working. Based in the organization main office is in Storuman, Sweden. We have around 15 employees, mainly in the northern part of Sweden. We're connected to the healthcare region of Region Västerbotten. Region Västerbotten is the second northernmost county in Sweden. We are around 15 employees and funded mainly through projects, project collaboration. If you take the next slide, please. Yes, this is the main focus what we're doing. We're working mainly with a primary care reform that is on the table in Sweden and that are going to be finally published by the end of December this year. And it's called Good Quality Local Healthcare in Rural and Remote, or Good Quality Local Healthcare is the primary care reform, and we have the twist of rural and remote areas in that context, what we are focusing on. But we have other focus areas as well. So we work with Sami health, education, and recruitment.
Yeah, and I'm coming from Nordic Welfare Center, that's an institution under the Nordic Council of Ministers, and we have offices here in Stockholm and Helsinki. Right now, we are. You have been following us from the two other webinars we had. You see that we are in another environment this time. We have a new studio. We are moving our office here onto Skeppsholmen in the center of Stockholm. A very beautiful view we have outside this November morning. Yeah.
Yes, I mean the starting point for this project, Healthcare and Care Through Distance Learning Solution, was the fact that we in the Nordic countries have a common denominating problem. And this is around the aging population, the demographic challenge that we normally mention. We see that the average age of our population is steadily increasing, and it's very, very hit hard on remote and rural areas. For instance, our collaboration partner in this project, Nordregio, has developed a map and an index called the Demographic Vulnerability Index, which indicates that 70% of the municipalities in the Nordic countries are vulnerable. And you are vulnerable when you have a population that is 19.5% plus 65. I think I can only speak for my healthcare region then, and the 7 inland municipalities that we represent our Center for Rural Medicine in the inland of Region Västerbotten. I think we have an average that are at least plus 30%. More than 30% of the population is plus 65. So we are definitely vulnerable. So that was the starting point when we started this collaboration. What we have seen when we have done this now for almost 3 years, is that we have seen an accelerating trend in use of distance planning solutions. So healthcare and care at distance is definitely on the table for all healthcare regions and municipalities across the Nordics. And this is very much connected to the COVID-19 situation, the pandemic situation of coronavirus that has hit us all hard. What we have seen from the Nordic countries is that we have had a very high increase in use of different technologies to support the population, both for healthcare and social services. But it's very much connected to video meetings that we see that are becoming more a common practice across the Nordics now. So we see that this is a trend, and we hope that this is something that will stay and that we will further develop this. So definitely COVID-19 response that we are collaborating with when it comes to Northern Peripheral and Arctic. This is definitely something that we have in common, and I think that we are going to focus today on how to fast-track innovation. And how to fast-track innovation is how you actually collaborate. So we have had in our project, we have tried to fast-track innovation through different calls. We have called for municipalities and healthcare regions that could actually, that wanted to initiate digital transformation, start to implement different types of services that should be supported with distance planning solutions. The first call was project started in September 2019, ended by the end of the year 2019. And what we could see from those projects is that they had a very, very good track record to actually succeed, but they all started at the wrong foot. And now we're having 12 new projects started in April this year. What we've seen, the major difference that we've seen this time is that most projects are very heavily focusing on how can we actually get the services out. So what we are seeing, we couldn't mention that what we are seeing from this project, especially from call 2, is more of a twist also to combine services regarding healthcare and social care. And we're going to hear 2 examples of that today, and how they have actually been supported and how they have worked to be able to fast track their innovation track that they are having in their strategic mindset. So maybe we could take the next slide here, and then you could run through the program. If we go back, I should mention this. This is then done in collaboration with Northern Peripheral and Arctic program, and they have this technology used for COVID-19 response webinar series. What we have with them is a small collaboration project called Tech Zones. And this is it's implemented and run under the lead of Professor John Condell at Ulster University in Northern Ireland. So this is very much an international event that we're having here. I think we're having participants from 9 different countries.
Yeah, 9 different countries.
We're happy to have that widespread information going out to all of you. And those of you that are listening today, you know that we are recording this session, and this session will then be published on our website. So you could actually spread the word to other people in your region that wants to take part of this and take this information in for later use.
Yeah.
Bengt, then you take the next slide.
Yeah, and of course it's after 1 o'clock. I think I said November morning earlier, a couple of minutes ago. Of course, it's after lunch. I'm a little bit confused here, but this is our program. We are doing introduction right now, and then we will start hearing from Norway, from Kjetil and Morten from Agder in Norway, and then we during their presentation, don't hesitate to write questions to them in their chat box. We will pick these questions up and ask Morten and Kjetil when they end their presentation around 1:30. After Kjetil and Morten, we will have presentation from Akureyri, from Sigurðsson and Halldór Sigurður Guðmundsson. We will talk about how they work for the Center for Welfare Technology. And we do have the same procedure. Don't hesitate to write questions in the chat. And then we have a discussion with Sigurður and Halldór from out of your questions. And then we will have a short discussion, a short sum up, and some information about the upcoming webinar in December. So, yes, I think I will stop sharing my screen here now and welcome Kjetil and Morten to start sharing their screen and making their presentation.
Yes, you can hear me?
Yeah,
very good.
Yeah. Thank you.
Yep.
Thank you. My name is Kjetil Løyning, and I have with me Morten Lauknes, which is going to say something later. Thank you for the...
Have they realized this? Kjetil, what do you think?
I think we have done something smart with the structure. But I think we, as we see it now, the administrative leaders and the political leaders, they want to see results. What is the benefit of this? We have worked with this now for 3 or 4 years. In the digital telehealth, we had the EU project all back to 2013. This is 7 years ago. Why haven't we seen more results? You can hear this, and I think one of the main tasks that we want to work with now is the leaders in the middle, not the top administration, because they see this and they agree this is something we have to do. But we have to get involvement to the I don't know the right word, but the leaders in the middle, because they have to let the service innovation be done. We have the technology available because the common procurement in 2017. We have to get them involved in how to do the work in a little bit different way, so we can see the benefits. And this is one thing. And the other thing, I think we see a lot of benefit. I had another meeting earlier this day, and in our website, I said we should have a benefit task. All the benefits according to technology, if it's telecare, telehealth, the response center, or so on, we put it in the same, so we could spread it to all the other municipalities. This is something that Grimstad municipality has knowledge. This is very smart. We have get this benefit in time or better quality or so on, and to share it with the others. We have to get more focus on the benefit realization.
Demonstrating benefit realization. This is also something that we know that has been a challenge in Exeter, which is another region that you have visited, that has been that they wanted to do better from start. So one of the tasks for any region that are starting this transformation is think of the different, indicators of success and try to monitor that very closely all along. But if that was the side of mid-management, was the next level that you need really to get engaged. But what are the population saying now? When they are, because you are actually raising this, silos. You starting to build a more and more seamless system. What are the population saying about this? Do they even notice that there is a difference, or yeah?
Yeah, Morten, could you answer quite
I think from the patient side, I think one of the benefits we see is that the patients feel more secure, they feel more safe being home monitored. So that's one of the key benefits we see, but it's difficult to take that kind of feeling of comfort, feeling of secureness into money. So that's one of the kind of to find how is that pronounced in money. Especially, but I think now it's interesting to see those 40 patients with COVID-19, because those patients was not patients who got services from before, but suddenly they're kind of getting home monitored, and I think it's much easier to see more results and more benefits from that. But it's one of the difficult things we're working on is just actually to see the money benefits, and to see the money benefits, you need to have a close relationship and close collaboration with the services, because they know which kind of patients can we swap a physical meeting with a digital meeting.
Yeah, we have another couple of questions here. There's one question, if you could tell us a little bit more about what you have doing with welfare technology and telecare and getting them together, as I understand the question.
The integration of healthcare social services.
Yeah.
Maybe you can say something about the innovation partnership.
We had a procurement, as I said, from 2013, and this the contract in telecare for Agder will end in October 2023. So at the same time, in this spring, we sent a søknad to Innovation on Norway and got innovation partnership. That is a way of procure. Then we have a competition in the start. We decide what are our needs together, both in the telehealth and telecare, and also we want to have solutions for people with a lot of needs from the primary healthcare and young people as well. So all these three areas, we go to the market. How could you solve this? And then they develop the solution in a year or so on, and then we could take it in operation in 2023 or 24. So we combine our needs from the different in one common procurement now. This is our next phase. And also, and one more thing, Niklas, this is one strategic thing we have done, the procurement process. The other important thing we have done this year, we have a steering committee meetings. Before we had several steering committees meeting with this almost the same people from the municipalities, some steering committee meetings with hospital and municipal leaders. Now we have combined all this in one program with several projects, and this is the steering committee of the program eHealth Agder 2030. And there you have municipal leaders and hospital leaders. They're sitting in the same room, but now in the digital room. And that's why they could see this thing in common. What is the needs in the telecare? What is the need in the telehealth? And we have to combine this, both also in the service. Mm-hmm. Not just the technology, but also in the service, how we organize this.
Yeah, I mean, I see two very important factors that you mentioned here. First, the one of how to govern the different projects so they could actually build synergies between them. And that's where you actually are doing that by collecting the steering committee members into one room. And it becomes the same steering committee members for all the projects in many of the cases. But the other thing that you mentioned about your innovation partnership is very important. I mean, that because you had a picture how you intend to break down the silos by drawing a number of lines between the different healthcare institutions and healthcare providers and different levels of healthcare providers, including the municipality. So would you say that in Agder, if I move there in 2028, can I actually feel that I have an integrated healthcare and social care system?
Yes.
That's very good.
In 2028, yes.
That we need to know. We're happy to hear that. But definitely front runner, very interesting to hear with you. A final word, because what we have supported you with, you mentioned that in your presentation is a kind of side support from not from within your organization, but from outside. In your case, it's an expert organization called PA Consulting that are a little bit pushing you to actually make the necessary decision in time so you don't delay any implementation. What is your feeling? Because you're 25 municipalities and a healthcare region. How important is this type of facilitation from the side?
Morten?
For me as a project manager has been crucial to have someone to chat with and to discuss with, but also to have that help to both on the strategic side to how do I enter this challenge and how do we communicate, how do we articulate this to different decision makers in different organizations? And I think that's, and also to the most kind of practical help, because we are filled up, we have a lot of work, so just kind of have some practical help on the way, and also they have some competences that we don't have. So to helping in business models, for example, and also but mostly kind of to articulate, how do we articulate this in the best way that the organizations and decision makers can help us making the next step.
Thank you very much. We have another question here from Fiona Morrison, and we're getting back to that, to our discussion.
Yeah.
So first of all, thank you very much for your time to actually take part in this. And Kjetil, you're going to stay more than you need to move on now for other meetings. Thank you very much. Good presentation.
Yeah.
We have a program to run.
Yeah.
What is the next step here for?
Next step is we are going to Iceland, to Northeast Iceland, to Akureyri region, to Sigurður and Halldór, Siggy and Halldór. You are going to present how we work with the Center for Welfare Technology and how we cooperate between healthcare and social care responsibility. So I let you in now, and I think it's Halldór that starts, isn't it?
Yes, so please unmute and put your microphone on.
Perfect. Welcome.
Okay.
If you put your camera on, then we see you also,
Yes.
all right?
Yeah. Hi. How are you? Thanks for the invitation, and it was an enlightening and inspiring presentation from Norway that we had the opportunity to hear now. What I intend, and Sigurður, we are going to discuss a little bit about, or present our thoughts and experience of working together with welfare technology. Is something that we are still discussing is what are we going to call it? Welfare technology or e-health or even both. Sigurður has pointed out that maybe we should mix the two words together and see this is wealth, not health or welfare, but the wealth that we can gain. But I would like to start with a little bit of, what should I say, tell you a little bit about the beginning of our cooperation. We have both been participants in a welfare technology program or in cooperation with the Nordic Welfare Center and the Vård og Omsorg, some VOPD project that we are participating in now. But before that, we started in the nursing home in Akureyri. We started with a project with a private firm in 2014, trying to implement and develop a software program to use in the nursing homes and also outside, and to contact people living at home. We have both the hospital in Akureyri and the nursing home has been working with other types of welfare technology or electronic devices like the health registry and other health programs or projects. Siggy could maybe tell you a little bit more about that, but at the same time, we both entered the VOPD call number 1 as presented before. And through that, we started a new type of cooperation because we got together and used one project advisor, Lisbeth Hjelberg. And through that cooperation that took place in just about 1 year or so, I think we have developed more closer relationship between our institutions, personal knowledge and trust that led us into the process of implementing or sending in an application for call number 2. And through this process of call 1 and 2, we have, should I say, at the same time as I can admire Norwegian people for being organized and structural in all approaches, the problem we have, or the things we want to in our organization is to get more structured in how we try to put our new ideas in some kind of structural process. And that is something that we have gained, I think, from the support and from Nordic Welfare Center and VOPD. And we have, through our cooperation, developed an idea, or we are now working with an idea of getting more structured, more organized, better organized for this side of, or this part of Iceland. And we want to establish some kind of a welfare tech cluster or a center that will have the opportunity or have the goal to implement welfare technology and e-health and work with quality of life and get our services and organization out of those silo approaches that we have been too much occupied of over the last years. So through technology and also through COVID experience, I think we have gained a new insight in the possibilities that we are going to try to implement in the northern area of Iceland. What I want to then discuss with you or present to you is some of the slides or argumentation for why we should focus on welfare tech cluster in this northern area, and try to present for you some of the challenges and some of the ideas and hopes that we bring into the situation and discussion about this Welfare Technology Center that in the northeast of Iceland that we have now in, should I say, preparation phase, or are trying to implement and activate. This project is supposed to, or should I say, I will base my argumentation or presentation on a report that we did a year ago, earlier this year actually, where we did a feasibility study of how of the challenges and opportunities about establishing a knowledge and service center in the field of welfare technology. And we may not need to discuss it specifically, but nevertheless, we know that the Nordic countries are a little bit ahead of us in both the population development of the population, but also in the context of implementing welfare technology. We are doing a lot, but we are doing it very much in silos, I think. But I don't have any research to back my statement with. So we have a report on how we want to do these things, and in that report we discuss the development of the population age 67 years and older in Iceland, and it is a little bit behind or a little bit later development than in the Nordic countries, and the same development as on national basis is going to happen in the northeast area where we are placed. We are also looking into the expectation and the reality actually in the both health services and welfare services that we are seeing increased life expectancy. We see that the health system and the social system are supporting people longer than or even more than before. And we see that the health system is developing all different parts or spare parts for people to get a healthier life or increased self-sufficiency. So this will have its consequences on the welfare services and health services in the future, probably as in all the Nordic countries. We have here just an argumentation for how important and how economic view on how important welfare technology can be. This is supposed to show you that we, with just implementing electronical system in regarding medicine and disposal of medicine and stock, then we get over the last 4 or 5 years a reduction in cost. So this system, in our view here at the nursing home, has been very well paid off if we just look at that factor. At the same time, we look to the Nordic countries, and this is a view of the media coverage in Denmark over the couple of years, saying us that this is a interesting theme to work on welfare technology, and hopefully get support from the local municipalities and state-wise. One of the issues that we are focusing on when we come to the welfare center is that the organizational chart over Iceland in regard to the health system or social geographical area for social services and other type of services, then we are having a little bit of difficulties because it is crossing the limits all over the place. So we have a rather old and complicated structure of the municipalities, of the health system, of the social system, childcare system, and other types of health and social services. So we hope to use the welfare technology to get a little bit over these barriers. In here we are discussing the welfare technology and the importance of implementing welfare technology and the argumentation for why it is so important for the quality of life in this area. And we support it with argumentation that we have both gained from our discussion and also from the discussion through our project and knowledge and participation in all other Nordic projects. We think that there are a lot of options in this area for gaining or participating in welfare tech center, and that would give the municipalities a new methods to deal with the type of services and population, quality of the population. Here I am just naming a few of the projects that we have been participating in that has gave us the upstart and learnings, hopefully some knowledge to bring with us into the welfare tech center we are hoping to establish. And also we connect that to our experience in the Nordic cooperation project. Our focus for the next steps is that we have lined up the target group, and we have also lined up the possible area of operation. In the first phase, we plan to focus on the northeast area, and the inhabitants there is about 31,000. We would like to expand it sooner than later to other sides of Iceland and also even in the whole country, because there is nothing telling us that we should not be able to operate on a larger scale if we get it running. Our hopes is also that the welfare tech center based in Iceland with the demography and the countryside as it is, that we might be an option for cooperation through the Nordic or Arctic Circle area. And that is because we have in this area both institution and experience from the hospital and the University of Akureyri to be a driving factor for some of the discussion and projects that are happening in the Arctic area. We have also set up potential partners or defined potential partners in the area, both inside in Iceland and also in the other Nordic countries. And we have in the report I mentioned, we have already approached some of those partners, and we have got positive, very positive responses. This is a type of, this slide is supposed to give you some insight on what we hope to gain, and we are getting some experience and numbers from Denmark and the discussion from other projects. And we also think that there's a lot of strengths and possibilities, so opportunities that we need to work on and present to the municipalities and private firms that are in this area. One of the interesting things from our point of view is that we need to structure the service, we need to structure the implementation process, and we need to have some kind of a learning and a knowledge base where both users and staff and organization can approach and get updated or get training for the use of welfare technology. In that context, we have developed our idea of a welfare tech center more in line of a welfare tech cluster, a cluster between both the organization, private sector, state and municipalities, and so on, even other parts. So what we hope to do now is to get some kind of further funding for the operation of this welfare tech cluster, and we have set up a schedule that implies that we are going to make some kind of a service agreement with the municipalities. Plus, we think that after 2 or 3 years, we might be up and running with income that can support or even driven this welfare cluster by itself. Here you have an example of how we see the income side of the management for over the next 2 years, both through subscription, newsletter, or education analysis, or even conferences. This is probably nothing new to you, but this is something that is relatively new for the representatives in the municipalities to think of in welfare tech and the welfare services. Then we line out what is it to gain for this area in Iceland. We look at the field of getting together, cooperation. We look at the knowledge base. We see the network and contact between local communities and even between the Nordic countries. We see the job creation option and the collaboration, and that we hope to be able to establish an operational center very soon. What we say in the end, we have the idea, we have laid it out, we have presented it, we get a positive response, but we need the takeoff permission. We need that. We are like a plane. We are fully loaded with people, interesting people. We are fully loaded with fuel, but we need a license to take off. And that is actually where we are at the moment. But the difficulties at the moment lies more in that we need to get some decision. We need to get a decision of participation and obligation to participate in this project. And we need partners, obligated partners, and we need to go over the obstacle that is probably the biggest one in the area. We have to get familiar with the idea that we need to stop doing what we are used to do and start doing it for a new way. And having said that, I think I go to you, Siggi, if you want to add something to it.
Thank you very much. I will share my screen if you stop sharing yours. So let's see here. this one here, and is it not on?
No, not yet.
No, yeah, it's
Okay.
coming, I hope. Is it there?
Yep.
Yeah, I would just want to elaborate a little bit on what Halldór said. And when we are talking about this WellTech cluster or welfare and health cluster, we need not only people with obligation and champions and financing. I think we need something that we might call the glue, and we need an infrastructure to make it work. And I think sort of some projects are better suited as a glue because they touch on all or most shareholders. And one of those projects that you heard before is the MEMAXI project, which is a sort of a system that combines a lot of things for an individual patient from different sources, both from the welfare and the health tech. And as Halldór said, the elderly homes have already started and are well on their way. The healthcare center has also started on this project. And we at the hospital are in beginning to work with this solution also, especially for the elderly and the rehabilitation care. And this is a sort of a picture of how an individual person often sees the society around him and the help they can need it or not. And this is the idea behind the project, that this is all combined and all comes together in this individual person. And there are a lot of IT solutions involved in this project that can help both in welfare and technology. This is a kind of solution that I can foresee that is a part of the glue of an operation like the WellTech or Well Healthcare cluster. So, and there are a lot of others, but I won't go into much detail now. We don't have very much time, but there are other infrastructures in Iceland that I think are beneficial for starting a cluster like this. And one of those is that we have a common EHR basically for the whole country, at least the public sector. There is almost finished a central pharmaceutical database. So no matter where you get your pharmacy from, or drugs, or is it in the pharmacy or in the hospital or in the healthcare center, it's all in the same database. So you have the updated information for every patient at every time. Here in the northern part, we have an alpha, which is also connected to the data to the pharmaceutical system, and a common medical management system. And then we have also that many of you know of is the Heilsuvera, which is the national patient portal. And this allows every patient, every individual in Iceland to have a secure communication with both the healthcare and the welfare through this portal, which is governed by the Directorate of Health. So we have a lot of things in our infrastructure that will help us to make this cluster work. In COVID-19, we observed that the use of IT and telemedicine, of course, started to skyrocket. Everybody had their meetings on Teams, and people are using just simple telephone calls instead of traveling long distances. And so we are learning a lot there. And we also learned that working together is better than working in silos. And for example, that Halldór talked about, our common project in the VOPD in the beginning was that we sat down in the same room and had good discussions about how we're going to implement our things, and we learned a lot about each other. And for example, now in COVID, the elderly homes, they came to the hospital with and said, we know you're going to have resources that are fixed on treating COVID patients. Maybe we can help you by giving rooms in our elderly homes for patients who are finished your treatment in the hospital. And so they helped us sort of help go through the epidemic. Now, there is also a question about conflict of interest, and I think that we need to address that the industry needs to be a part of this. It needs to be a stakeholder in this, and we must not shy away from that, because they have the solutions, and the solutions are already there. We just need to use them. So these are just a few extra points that I would like to make after Halldór's presentation, and finally I would say, who doesn't want to live here, and we are ready for questions.
Looks beautiful, Sigurður. Very good. Thank you very much for the presentations. And what I hear from you is that you're working both, with a vision, looking into developing a joint center for e-health and welfare technology that could actually benefit, that could be a joint benefit for the municipalities as well as the healthcare region. And this is very, very much kind of a building block that could actually be a quick way forward for you in North Iceland, Northwest Iceland, of course. And to some extent, Halldór, maybe the disorganization of Iceland is actually a benefit in this case, because then you know that when you start speaking to each other, then you see that you have more in common to work together than to work in silos, as Sigurður was mentioning. I would like to hear, because you think of this center to be a little bit a center for you in Northeast Iceland. Do you foresee that other centers of similar kind could pop up on Iceland, or should we see centers that are joining you from other Nordic countries, or how do you see this network of implementation and development experience that you envisage to develop could, flourish across the Nordics?
I think that we should not start by building fences. We should be very open to, and we have already discussed that, for example, the healthcare center in the east of Iceland, which we have a very good communication with, and we send our specialists there, and they have same problems as we have, and there's no reason why we can't join to find the same solutions for the same problems. And as you know, we've been working for many years both with NPP and NPA project, and one of the things that we see often is that rural areas in the Nordic, rural and remote areas in the Nordic countries and the Arctic circles have maybe more in common between countries than between rural and urban area in each individual country. So I think we should be very, very open to at least have a collaboration and share ideas and brainstorm.
Yeah, I can only speak for my Center of Rural Medicine. This is something that we would be interested in joining this type of initiative and see how we could develop different e-health welfare technology hubs across the Nordics, especially from the point of view of rural settlements, because the level of simplicity and the level of complexity is much lower and the level of simplicity is much higher if we start in rural remote areas when developing these systems. So it doesn't have to be that complicated. It could be that we start speaking to each other. Halldór, you had a comment to this as well.
Yeah, I agree with Sigurður that we need to be open-minded, but at the same time we need some, in this area, in the geographical area where we are living, with all these different stakeholders or municipality, state, organization, and so on. I think we need the knowledge center, we need the service center, we need the we need to gather the specialists in a way overview that is not the object for each one, but get it together so we can have a driving factor in the area that is helping us to work. But it's going to work remotely. It could be people working from Denmark for that matter, but we need to have it in some way in our something that we are combining together. But at the same time, I have always seen this welfare tech cluster or center. The biggest issue is the pipeline between us and between the countries, Nordic countries. We need the information pipeline, and I have even in some discussions said that we need to look at the welfare technology and this cluster in a way like an apartment or a block of many apartments, and we have information demonstration in each room of those apartments, and it can be placed everywhere. It can be placed in the web or whatever.
I can, for the Nordics that are listening today, I know that Nordic Innovation, which is an innovation institution through the Nordic Council of Ministers, they are now setting up a sandbox testing center, you could say, or a sandbox testing hub, where they are testing equipment for both welfare technology as well as healthcare technology. So what I think that you should consider in your case is, how do you involve the population? How do we get the people's voice heard in a center of this kind, as well as the professionals doing the hard work, the daily work within your organization when it comes to this type of development, the digital transformation?
Yeah, I think there should be a few things there. Firstly, like we talked about, is the involvement of the municipalities, because they are representative of the people in the municipalities. So that's very, very important. And also, I think we should have a very simple and very achievable goals. And the main goal should be better service for the society. That should be the overhanging goal for everything that we do. And if we have that, then I think we get the people with us. And also, I would like to mention that one partner also needs to come into is, in my mind, is the university here in Akureyri, which is very advanced in their technology of teaching through IT solutions. And I can foresee that a research center like Lesbimedicine Centrum can easily, well, not easily, but it can be developed here in Iceland compared to what you do, because I've been to your center, and I think it's a brilliant idea. It's almost an industry in a small community.
It is definitely. I mean, we're 2,000 people living in the central part of Storuman, and between 15 to 20 are working at this center. So we are a player in that context in the community, and we are a big player, a big industry in that community, and we produce knowledge that are beneficial to the population. So, but what I think, what I hear from you is that you don't want to work alone. You want to work together with others. You want to open up this. You want to start from your position. So your point of view is at focus, and you think that it's easier to transfer the knowledge from you to others if you bring in the population and bring in the municipalities and the professionals from that point of view. Did you have any questions, Bengt?
No, I don't think I have any questions. It's very clear what you were aiming at, and I'm very glad to hear what you're doing and the cooperation between healthcare and care. We need this, because when we see in the spectrum of COVID-19, we can see that integrated healthcare and care is crucial to do this when it comes to, for example, people with COPD or other chronic diseases that we need to work more in this area. So
and we can say from our point of view, we welcome that we start from the position of healthcare and social care transformation. And it's a little bit what Sigurd said. I mean, bring up the service level to great standard again. in remote and rural areas. And we can actually do this with digital transformation. It doesn't have to cost that much, and we could actually tailor the services better for the population's needs.
Yeah, I can give you an example of what happened in COVID. Actually, through Landspítalinn, they just put up a outpatient ward where every patient who was diagnosed with COVID-19 in Iceland and was at home, they got a telephone call in the beginning from a doctor who assessed them on regular basis by nurses, and they went to a certain assessment. They got a color code which is accessible to all the doctors who need to, the whole list, be it green, yellow, or red. So we could have the whole COVID infection pandemic at a glance at every moment in Iceland, how people were faring. And this was done in a few days with IT technology, a few days for a whole country.
Something that could have taken a couple of weeks, couple of months, or years if we just
or decades.
But maybe if we bring Kjetil back to the screen here. Kjetil, can you hear us? I hope so. And put on your microphone.
Perfect.
Welcome back, Kjetil. We thought that we should have a final discussion here around 5-10 minutes. A very short one, but we have had a question during your speech here, Kjetil, and I think you could be the first one to answer this one, Kjetil. This relates to what if we develop the services as you have outlined. I do understand that we're not ruling out the physical healthcare meetings and the physical meetings when it comes to social services. But are we actually, in the long term, creating a society that are not beneficial to the population on the long term? It's a philosophical question, but
to try to ask it once more.
Yeah, I mean, the question is, if I read it to you, I mean, if the users are behind the blue screen of technology, and you develop the services through technology constantly, and you increase the service level through technology, and this could be good, of course, during pandemic times. But what happens to the traditional physical meetings that we have experienced from social services and healthcare services? Are we losing out on some factors here that we can't compensate with technology?
Yeah, that's a quite big question, and I'm not sure I'm the right to answer that. But quite difficult. I could try to say something, but one perspective is the demographic changes. We have to do things different. That is one issue. The other one is, I think, as I showed the illustration about the digital maturity, I think more and more people expect digital solutions. If you see in the bank, fewer and fewer go to the bank. No, you want it on the mobile. That is how you expect it to be. So I think the change is also because I, as an individual and a patient and a citizen, I expect it to be digital. See, that is the second point of view. The third one is isolation. That is to be alone. In the COVID-19, this is we had a discussion of the morning coffee one of the last week, because the national government says that you can't meet more than 5 people. But what about the people who hasn't got the invitations? You see, this is quite the pandemic gives us fewer possibilities to meet other people. That's you see. So I think we have to solve both the demographic challenges the technological that people want to have, and also how to have the social contact. I don't have the answer, but we have to. This is a challenge, but we have to solve also.
Siggy.
Yes, I would turn it around, and I would say we don't want to go. We know that in many cases the physical contact is the most important thing that you can do as a service. So we should use technology to free up more time for physical contact for clinical personnel to be bedside or at the home with the patients or others who need services. And I would like to point out that, for example, the electronic journals that we are using, they were in the beginning, they were produced by people who were gathering data. And they are gathering journals from the beginning, and they used clinical people to gather data. Clinical people shouldn't be gathering data; they should do clinical stuff. Yeah. So when I have a new thing that people want to implement in my hospital, and I say if that creates an hour before the computer screen, you have to save 2 hours somewhere else before the computer screen to make it work. So I would like to bring people back to the patients and let the data gathering to the data gatherers.
Yeah, if I can add to we have, I think in the Nordic context, we have had a saying that use the people for communication, but use the technology for do the work.
Automation.
So in a way, I mean, there's also this discussion about or thoughts about that there is a contrast between the welfare or communication or well-being and technology. I think if there is anyone in this room that would be willing to throw away his own telephone, I would like to hear from him.
Niklas. Yeah, I agree with the Icelandic colleagues here. Several years ago, we talked about cold technology and warm hands. That was in Norway. And now we have another artificial intelligence. This is also a big trend, and we don't know how this will solve some issues and maybe give some other challenges. But a guy I talked to yesterday, he said they don't use the word artificial intelligence, but assisted intelligence. And that's very interesting, because we have to, as you said from Iceland, we need to find intelligence, artificial intelligence to assist, for instance, the GP to get better answers, better decision, faster decisions for the better health. And people could do the people needed work, and the machines and the technology and the artificial intelligence could help us.
Thank you very much. Final comment by Siggy before we move on.
Yeah, just to comment on the artificial intelligence. I was at a meeting a year ago in the NHS Innovation Center. They were talking about artificial intelligence, and one guy who I respect very much, he said, when people start to talk about artificial intelligence, stop listening. There is no such thing. There's machine learning and assisted intelligence, but no artificial intelligence.
Yeah. Very good. Thank you very much for this conversation. You could disconnect the picture and the sound for now. And me and Bengt are going to do some final slides here before we end this session.
Yep. I can't see what this is.
No.
Do like that. There we go.
So, if I take the next slide.
Yeah.
Yeah, very good. As we mentioned, we have had earlier webinars, 2 of them, and they are both at our website. This is the link to the website. You could also type in VOPD with a single VOPD.NU, and then you get there if you can't write this down at this moment now.
Yeah, and this webinar today is also recorded and also will be placed there later this week.
Yeah, if you take the next slide. We also had the previous joint event with Nordregio, and they recorded their session, and it can be found on Nordregio's website. And this is rather well-being session in the Nordic regions and the potential of digital solution in healthcare and social care. So we're having one more webinar to come, and this is decided to be on the 14th of December.
Yeah.
This is an additional webinar to this technology use for COVID-19 response webinar series. It's very much focused on the challenges that Kjetil described today about how could we actually break down the silos and how can we actually use different type of health data generated knowledge into healthcare and social care. So we're looking into the bottleneck. What we see is a bottleneck as the systems are designed today, and what type of innovation that we see in future is needed to actually be able to scale up the opportunities of self-monitoring, self-care opportunities from people's own homes.
We could say that on the 14th of December, when we have this webinar, we won't come with any solutions or so. It may be more of a discussion, what we need and what will come, and how could we possibly go further in this area, because this is really something that is challenging us, but also gives us a lot of opportunities from now on.
Hopefully we can find some partners that wants to collaborate with us on this.
Yeah.
If you take the final slide then, what did we learn today? We have heard 2 regions in the Nordics, Agder region and the region of Northwest Iceland, Akureyri region, speaking about digital transformation. And we have a statement that we use, a message, and digital transformation is one key to create a patient-centric, integrated healthcare and social care. As you can hear both from Norway and from Iceland, they look into how can we integrate the services. Kjetil demonstrated a very comprehensive system that they are trying to develop in Norway, while you see more of a starting phase in Akureyri coming up, where they start to use some services as a glue between the different organizations. But still, and this can't be stressed enough, I mean, technology is not the challenge here, it's the culture that is challenged. So it was also spoken about a lot of data today, you mentioned data, and I normally say that data has no mess. So by that, we should not focus that much on data. Data is only for use. So, and we should make data accessible for practical use and be able to find a system that can transfer data, because it's not that heavy to transfer. And finally, focus on transition of your culture and to embrace this opportunity. And I think that's our final word for today.
Yeah, it is. We have a couple of minutes left, but then you can have a couple of minutes more to do other things this November afternoon. So thank you very much for this webinar. Tune in on the 14th of December. And if you want to see this again, you can find it recorded on our website.
Very good. Thank you very much.
Thank you.
Bye-bye.
Bye-bye.